Hi, everybody, and thank you for joining us today for this Knockout Opioid Abuse Day mini webinar. And we appreciate your participation this year in Knockout Opioid Abuse Day and for your commitment to fighting the opioid epidemic in your community and throughout the state of New Jersey. Today, we have with us Ariel Mayer from the New Jersey Acupuncture Society, who's going to tell us a little bit about acupuncture, mainly its role in treating pain as well as addiction. So we're so happy to have Ariel with us today, and I'll hand it over to her.
Thank you, Matt, for the introduction. And I want to, on behalf of the Acupuncture Board, I want to thank the Partnership for a Drug-Free New Jersey for inviting us to give a presentation on treating opioid addiction with acupuncture. Next slide. What is acupuncture? Next slide. Acupuncture is a form of complementary medicine based on traditional Chinese medical theory and how energy is balanced in the body. It has been used for thousands of years to treat many different medical conditions. Next slide, please. During an acupuncture treatment, thin, solid, sterile needles are inserted into specific points along meridians on the body. This affects how energy, referred to as qi, flows in the body. Each acupuncture point has a function that can not only affect the physical body, where people experience pain on a musculoskeletal level, but also address mental and emotional imbalance, which cause distress, fear, anxiety, depression. Next slide, please. The insertion of each needle is done with care and expertise by a licensed acupuncturist using only sterile single-use needles. The sensation of needling varies for each patient. Many experience a sense of relaxation and comfort once the needles are inserted. Highly stressed patients can relax as acupuncture reduces the flight or fight response of the sympathetic nervous system. Next slide. Licensed acupuncturists are highly trained individuals. They're trained in theory and application of acupuncture during a 2,500 plus hour accredited master's program. In our home state, acupuncturists are required to hold a 4-year bachelor degree in addition to their education in traditional Chinese medicine. Next slide, please. People most commonly seek out acupuncture treatment when other avenues have not helped to reduce severity and frequency of their pain. Their first visits are often related to pain in their back, neck, head, and joints due to injury, aging, overuse, underuse even. Acupuncture mitigates pain by improving blood circulation, moving stagnant qi, reducing inflammation, reducing swellings, and releasing endorphins, producing an analgesic effect. Next slide. In addition to pain management of acute and chronic conditions, the WHO recognizes acupuncture to be a proven effective therapy for a wide variety of conditions, including, but definitely not limited to, women's health, infertility, weight loss, sleep disorders, chronic fatigue, IBS, GERD, support for cancer patients suffering from pain and nausea, arthritis, addiction, muscle pains, migraines, stress, and anxiety, which is common for so many people in our society today. Next slide. Acupuncture and pain management. Next slide, please. Acupuncture originated thousands of years ago in the East, but gained notoriety in the United States in 1971. At that time, a member of the US Press Corps, James Reston, was suffering from appendicitis. He received acupuncture to treat his pain following an emergency appendectomy while traveling in China. His experience was later reported in the New York Times, which created a growing interest among US physicians and holistic healthcare practitioners. They were mystified by the sedative and analgesic effects of acupuncture. Next slide, please. In James Reston's own words, "I was in considerable discomfort, if not pain, during the second night after the operation. And Li Changwan, doctor of acupuncture at the hospital, with my approval, inserted 3 long, thin needles into the outer part of my right elbow and below my knees and manipulated them in order to stimulate the intestine and relieve the pressure and distension of the stomach." Next slide, please. Since then, acupuncture has grown in popularity in the United States. Scientific studies continue to report the efficacy, particularly in the treatment of pain. Acupuncture is being added to hospitals, multidisciplinary clinics, fertility clinics, and other biomedical settings as it's incorporated into mainstream medicine. Acupuncture is gaining notoriety as an affordable adjunctive therapy without the risks and side effects associated with prescription medication. It's an effective non-pharmaceutical modality to relieve pain and reduce stress. Next slide, please. Acupuncture and addiction. In 1974, shortly after James Reston's experience in China, acupuncture for a drug addiction detoxification program began in the United States at our neighboring Lincoln Hospital in the South Bronx. Acupuncture was incorporated into their methadone detox program. It was administered in a group setting using a specific set of ear points. Patients were treated twice a day while tapering off of the methadone. It was a huge success. The auricular acupuncture protocol led to a significant reduction in withdrawal symptoms and improved program retention. Next slide, please. In the 1980s, during the crack cocaine epidemic, acupuncture was again used with great success at Lincoln Hospital, helping patients recover from addiction. In 1986, the National Acupuncture Detoxification Association, NADA, was established as a way to train acupuncturists in the NADA protocol. Since that time, the NADA protocol has been widely used in private and community clinics to treat addiction and withdrawal symptoms. Acupuncturists will use this auricular protocol along with points on the body to treat all types of addictions, from tobacco to food to alcohol to street and prescription drugs. Next slide, please. The NADA protocol consists of 5 points on each ear. Patients can be treated while seated in a chair, individually, or in a group setting. The simplicity of this treatment makes it an ideal part of addiction recovery. So if patients are not comfortable with coming in for full body treatments, they can start with auricular therapy. Next slide. How acupuncture helps with pain and withdrawal. Next slide. Acupuncture and the brain. Why does it work? Acupuncture stimulates the central nervous system and balances biochemical reactions to alleviate pain and addiction by modulating neurotransmitter ratios such as endorphins, serotonin, and opioid receptors, as well as amino acids such as GABA to alleviate pain and addiction. Next slide, please. Acupuncture and electrostimulation. In addition to manipulating the needles with one's hands, a practitioner may decide to also use electrostimulation. Electrostimulation, when attached to acupuncture needles, can be used at varying frequencies to affect hormones, neurotransmitters, and amino acids differently depending on the setting. For instance, the lowest frequencies stimulate endorphins, whereas the higher frequencies stimulate GABA. Next slide, please. Acupuncture and trigger points. Patients coming in for treatment may be experiencing pain referred from trigger points, which are tight, tender spots on the muscles. Trigger points are a sign of muscle overload and can cause a muscle to function poorly. This often leads to pain, spasms, even paresthesia due to the taut bands compressing on nerves and inhibiting the free flow of qi and blood. Acupuncturists who specialize in this type of orthopedic treatment are expert at locating trigger points and releasing them by gently stimulating 1 or 2 needles in the muscles to cause a twitch response. This twitch response allows the muscles to relax, thereby reducing tension and pain. Next slide, please. Frequently asked questions. Next slide. The first question many people have is, what does acupuncture feel like? In general, acupuncture is painless. A few points may be more sensitive than others, but once the needles are inserted, many patients do experience a sense of deep relaxation. Next slide. Another question is, how big are the needles? When patients think of needles, many think of getting shots. A vaccine needle is actually 60% larger in diameter than an acupuncture needle. Acupuncture needles are filiform needles, meaning nothing is injected. They are really thin and as thick as a strand of hair. Next slide. How safe is acupuncture? Acupuncture is very safe in the hands of a well-trained and experienced practitioner. The most common but not usual side effects may be slight bruising at the site of insertion. Other individuals, older ones on blood thinners, may bruise more easily, but that's not the case for all patients on these types of medications. Next slide. Is it contraindicated with my medications? No. If your practitioner prescribes an herbal formula, he or she will go over your medications to make sure there are no possible interactions. Next slide. How does it work? Acupuncture treatments are prescriptions are, start over. How does it work? Acupuncture treatment prescriptions are based on protocols for balancing and clearing the channels. Points are selected based on patient's needs. A very simple explanation is that pain is caused by blocked energy. Clearing those channels will enable energy to flow freely and result in pain relief. Next slide. How many treatments will patients need for pain management? Patients receive individualized treatment plans based on their specific needs. A practitioner may want to see a patient once or twice per week to treat the pain and help resolve the discomfort. Some patients may experience significant pain relief after the first treatment. In general, practitioners like for significant or sustained improvement after 4 to 6 treatments. Depending on the severity and acute or chronic nature of the pain condition, some patients may need to come for several months. As the symptoms alleviate, frequency of treatments is reduced until the condition is resolved. Some conditions benefit from maintenance after the acute flare-up is controlled, typically 1 to 2 sessions per month. Often when their pain is resolved, patients discontinue treatment for long periods of time. They return to their acupuncturist if they experience a new pain, knowing this is a safe place for them to come that has good results. Next slide. How many treatments will patients need for addiction? Addiction is a tough condition to overcome. Patients receive about 1 to 3 treatments per week for 3 to 4 weeks, then once per week until they are well into their recovery. Acupuncture can help patients achieve and maintain their sobriety. Acupuncture has been shown to calm anxiety, relieve insomnia, and reduce the irritability and cravings that often accompany withdrawal. The calming effects of acupuncture are so significant and long-lasting that patients can get into a meditative state naturally and on their own outside of the acupuncture clinic. There is a newfound sense of freedom. Next slide. Closing statements. Next slide, please. In the light of the ongoing opioid crisis, patients and healthcare practitioners are looking for solutions to both prevent drug addiction and to help those already afflicted by it. We see acupuncture as a valuable tool. Acupuncture can be used to alleviate pain, preventing the need for addictive prescription painkillers. It can also be used to help patients as they taper off their medication or wean themselves from other addictions. Acupuncture has been successfully used to treat pain for thousands of years. It is safe and effective. Thank you very much.